What's up, guys? So today we're going to be talking about bedside report, how to give clear, concise, and simple nurse-to-nurse handoff that'll help you during post-shift. So let's not waste any more time. Let's jump right in. So what helps me give handoff is just keeping it simple. I break it down into three main stages. The first one being simple information: name, date of birth, code status, allergies, what brought them into the hospital. Past medical history is important, but what in their past medical history specifically brought them in? Were they a CHF exacerbation, a COPD exacerbation? Did they go into AFib-RVR and had to come into the hospital? What specifically brought them in? So that's the first main chunk of my report. And that flows really nicely into a focused head-to-toe assessment. So focused head-to-toe. That's going to be the meat and potatoes of your report. The neuro, cardiac, respiratory, GIGU, lines, Foley's, etc., pertinent labs. We'll run through a head-to-toe really quickly. Neuro status, just know your changes, know the patient's baseline. Are they alert? Are they oriented? Do they follow commands? That way I know if something deviates from that, I know hey, a red flag's going off somewhere. Cardiac, where does the patient live heart rate wise, blood pressure wise, what's normal for them, if they're in AFib, has it been controlled? That way I can be tipped off again to anything that changes. Respiratory, same thing. How much O2 are they on? How much do they need normally? Do they wear O2 at home? Do they need BiPAP? Stuff like that. GIGU, have they pooped recently? Is their abdomen distended? How do their bowels sound? Foley's, labs, urine, it all kind of flows nicely into a nice pattern, because when you're talking about urine output, that leads right into your discussion for labs. Labs are important. I implore you to look at them before each shift. You can see the trends. Big key in nursing, knowing your trends. Where has this patient been? Where are they going to? So pertinent labs I like to talk about: potassium, chloride, sodium, magnesium. Oh God, I feel like I'm doing my NCLEX here. Creatinine, big one. See if that's spiking up, something's wrong. Their white blood cell count, their hemoglobin, all those labs are pertinent. And then there's certain ones that you need to replace, especially if you're in the ICU. So be aware of those as well. And that leads you perfectly into the third and final segment. Hey, what's going on with the patient's family? Do they have family members that call in a lot? And then their pain management, miscellaneous items like those. And then that leads into like the final topic of barriers to discharge plan or plan of care. So you touch on, hey, we're just waiting for a sniff right now. We're waiting for home health care. We're waiting for case management to set up all those things. Or they're not quite healthy enough to leave the hospital yet. We want to stabilize those labs. We want to stabilize that heart rate, stuff like that. And then, yeah, just tie it up with a nice, neat bow. That's it, guys. That's it. Bedside report made easy, man. 3 key segments that flow kind of right into each other is really helpful for me. So yeah, guys, that's it. Bedside report doesn't have to be super complicated. Again, just follow those 3 segments that kind of flow nicely into each other. Down in the description is a free report sheet for you guys. Download that, print it off, use it. It's a good basic, practice report sheet. Sometimes these units will have like report sheets from the 1950s and they look so outdated. So yeah, grab that for free. Continue to like these videos, subscribe to the channel if this is helpful for you. Let's continue to grow. Let's grow a community of nurses supporting nurses. It's been a rough couple years out there for for everybody. So let's keep it positive in 2023, guys. Good luck in your next shift. I'll see you in the next one. Peace. I forgot to say something. All right, so one key pro tip that I like that's helpful for me, I put aside at least 30 minutes, 20 to 30 minutes of my shift to look up all my patients' information. So that way I can rewrite my report sheet. Pro tip, look for the infectious disease notes. Those doctors do a really good job of putting a comprehensive plan for that patient. And the hospitalist group. If you have like a HMS service or a hospitalist group service, those two provider services do a really, really good job of having a comprehensive plan. Again, these are in your inpatient notes in Epic. Pull those up. If you don't have Epic, I don't know, I'm sorry. So pull that up. Look up the infectious disease doctors and the hospitalist group, and then they literally have the whole body systems like in doctor terms. So obviously kind of like dumb that down a little bit, but unless you guys are smart, but they have that whole body system list and it flows really nicely and it's very comprehensive. So look those ones up. So pro tip.